Warm welcome to our second webinar, Rethinking Corporate Accountability in Global Health, Beyond Rankings and Voluntary Measures. So this is our today's webinar is in Spanish and in English. We speakers are asked to speak very slowly and very clearly. I will come back to this in a second, to the why. And yeah, I'm very glad, very happy to have with me Diana Silva and Ashka Naik. I will introduce to them in a second. And our webinar objectives today are exposing the limitations and risks of voluntary corporate scorecards, highlight harmful corporate behaviors often overlooked by rankings, present principles for effective corporate monitoring and accountability, and foster dialogue on systemic reforms needed to regulate corporate power in health governance. My name is Katharina Miller. I'm founding partner of Miller International Knowledge, and I'm very happy to be here today with you to moderate this wonderful panel with our excellent panelists. Before we start, some housekeeping rules. This webinar, as I told you before, will be done both in English and Spanish. There are live captions and a translation. And you should have received before the webinar starts a captions tutorial, which had been shared with you in the chat. So please make sure to open this document and to acquaintance yourself with the instructions, because one of our speakers will give her presentation in Spanish language. And you are very much invited also to raise questions during the webinar, maybe in the chat. And then later you can also, we are very much invited to raise your voice, to open your micro, also share your camera with us so we can interact with you. Today's webinar, we want to give you an overview of the rise of voluntary market-based accountability measures, the rationale for establishing the independent expert group and producing the statement. Before I will now introduce you to our two speakers, I would like to make the conflict of interest declaration. The Independent Expert Group, the IEG, is convened by the United Nations University International Institute for Global Health. And this organization receives core funding from an endowment was provided by the Malaysian government. However, we, the IEG members, serve on a pro bono basis, so we don't have a conflict of interest. I will now come to introduce our first speaker, Dr. Diana Silva, or Diana Silva. Diana holds a PhD in social science with a major in sociology from El Colegio de Mexico. She has been a professor and a researcher at universities in Mexico. She's currently a researcher at Poder on issues related to human rights, corporate capture of the state, and the environmental impact of non-offshoreable companies in communities, especially in infrastructure, mining, and energy. In the aftermath of the pandemic, her work has also expanded into understanding corporate capture of healthcare. And now, dear Capucine, could you please share the photo of Diana? With this photo, which you should now be able to see. Yes. So Diana really likes this photo that you can see now on the screen, which represents one of the things she enjoys most, hiking and climbing mountains. And in this picture, you can see Mount Tlaloc, a place that has a ceremonial center at 4,000 meters above sea level. Thank you very much for sharing. Diana will later focus on the ATMI and ATNI limitations. I come now to our second speaker, Ashka Naik. Ashka is a food policy expert and a research activist with 2 decades of international experience working across food and climate justice, issues of corporate accountability, and women's rights. She currently serves as the Chief Research and Policy Officer at Corporate Accountability. Ashka's expertise is focused on tackling structural and commercial determinants of nutrition, well-being, and health. She serves on several experts groups and liaises closely with the World Health Organization, UN, on issues of corporate power and accountability. She's a PhD candidate at the University of Massachusetts, investigating intersectionality of food, power, and gender. Ashka's work has been covered by platforms such as the New York Times, Washington Post, Stanford Social Innovation Review, and World Nutrition. Ashka's ultimate dream is to have a thriving farm in the Himalayas, preferably a mango orchard, if the rapidly changing weather patterns and reckless destruction under the guise of development in the region allow for it someday. We hope for it. Ashka will focus on standard limitations and effective corporate accountability as the second speaker. And I would now like to give the floor to Diana, who will speak in Spanish. And now for the English-speaking members here, audience in our community here, would be the moment to switch the translator. And Diana, whenever you're ready, I will now give the power to you. Thank you very much.
Thank you, Catarina. Gracias. Buenos días a todos y a todas los que nos escuchan. Espero que estén pudiendo acomodar los subtítulos y que me puedan estar leyendo en estos momentos. Así que bueno, primero agradecer a las organizadoras por permitirme participar en este evento y en este esfuerzo colectivo que ha sido el grupo de expertos independientes en monitoreo corporativo y rendición de cuentas en salud global, IEG. Y bueno, esto ha sido resultado de más de un año de trabajo colectivo para pensar estos temas, que viene también de reflexiones previas y reflexiones que cada uno desde sus trincheras, ya sea desde la academia, desde la cooperación internacional, desde las organizaciones de la sociedad civil, ha realizado. Esta presentación pues busca dar digamos, mostrar el planteamiento del problema de donde partimos para este posicionamiento. Como decía Catarina, yo soy investigadora en Poder. Poder es una organización de la sociedad civil en México que trabajamos rendición de cuentas empresarial. Hacemos investigación corporativa con enfoque de derechos humanos, acompañamiento a comunidades afectadas por la actividad empresarial. Antes de iniciar, quisiera la siguiente, por favor. Hacer un descargo de responsabilidad para hacer este descargo. Poder se financia fundamentalmente a través de subvenciones y donativos de fundaciones filantrópicas y de la cooperación internacional. Somos una organización que recauda fondos, pero no procura ningún financiamiento de gobiernos en países donde tenemos nuestras operaciones ni en fundaciones controladas por las empresas. La siguiente, por favor. ¿Cuáles fueron nuestros puntos de partida? ¿No? Lo primero era reconocer las transformaciones recientes en la economía política global, que ha consolidado cada vez más el poder de las corporaciones transnacionales y debilitando la capacidad regulatoria de los estados. Vemos cómo los fenómenos de la liberalización económica y los mecanismos de gobernanza favorecen cada vez más la autorregulación por parte de las empresas, incrementando su poder. documentamos cómo las corporaciones han contribuido al deterioro de la salud y al aumento de las desigualdades. Específicamente veíamos el incremento de las enfermedades no transmisibles en todo el globo, pero con particular énfasis en los países con menores ingresos. Estas desigualdades se exacerban con prácticas comerciales que han sido nocivas, particularmente la evasión fiscal, la explotación laboral y la presión indebida a nivel político. También habíamos visto y documentamos una gran cantidad de mecanismos no vinculantes que hacen o que buscan que estas empresas tengan en cuenta algunos criterios relacionados con los derechos humanos. Sin embargo, vemos que estos mecanismos no vinculantes no funcionan de manera adecuada. Particularmente a través del estudio del índice de acceso a las medicinas y el índice de acceso a la nutrición. Estos dos índices se presentan como soluciones de mejora para el acceso a medicinas y a una mejor nutrición, pero carecen de una serie de fallas metodológicas que, digamos, no muestran un impacto real en la salud de las personas. También veíamos cómo estos índices permiten legitimar la influencia corporativa en la gobernanza sanitaria y alimentaria. Entonces, la siguiente, por favor. La siguiente diapositiva, por favor.
Next slide, please.
Hello.
Can we have the next slide, please?
Bueno, en lo que nos apoyan con la siguiente diapositiva, un poco lo que veíamos de estos rankings corporativos mal diseñados, es que, bueno, cuentan con unas características que ordenábamos de la siguiente manera. Por un lado, estándares débiles que les hacen ver más responsables de lo que realmente son, ¿no? En este caso, son estándares que carecen de un enfoque de derechos humanos, ¿no? Cuando hablamos de los criterios ESG, por lo general en la S se coloca todo, ¿no? Se coloca todo sin una debida diligencia en derechos humanos, ¿no? Son estándares que están por arriba o más bien por debajo de lo que se requiere para lograr un acceso efectivo a la salud y a la nutrición. También vimos que estos rankings se enfocan solamente en la provisión del producto, ¿no? De cómo este es entregado en el mercado, pero no tienen en cuenta una serie de malas conductas corporativas que terminan impactando de manera negativa en la población, ¿no? Por ejemplo, la manipulación de los resultados científicos, empresas que financian los resultados o las investigaciones con un sesgo particular, ¿no? Que les beneficia. Otra cuestión que veíamos era el lobby, que es esta influencia indebida en los tomadores de decisión, las irregularidades financieras, el abuso fiscal corporativo, las prácticas laborales abusivas y la contaminación, solamente para nombrar los más relevantes. También veíamos una dependencia en estos índices excesiva de métricas estandarizadas y cuantitativas. Son por lo general índices con una serie de indicadores que generalmente dan como resultado una puntuación. Sin embargo, esto deja por fuera gran cantidad de análisis que están centrados por ejemplo, en los impactos que viven las personas y las comunidades afectadas, ¿no? Que pueden dar una imagen mucho más completa de cómo está operando determinada corporación. También la visión de la sociedad civil, que documenta graves violaciones a los derechos humanos. Periodistas que están en terreno, ¿no? Contactando a las personas y que pueden dar una visión mucho más amplia de, de cómo está operando una corporación. También veíamos que en estos rankings, por lo general, hay datos deficientes y poca transparencia. Por un lado, se construyen con información que presentan de manera voluntaria las empresas transnacionales, que no sabemos, digamos, si vienen con algún tipo de manipulación o no. Digamos, no hay una instancia independiente que genera esta información y estos datos, y los cálculos y las metodologías de cómo se llega a un resultado no son públicos. Entonces, esto reduce la transparencia de estos rankings. También otra falla es que solamente incluye a las grandes transnacionales y dejando por fuera a las empresas más pequeñas, y no tiene en cuenta la operación de esa determinada empresa en toda la cadena de suministro. La cadena de suministro, pues, es todas las compras o todos los aspectos previos, ¿no? De compras de insumos que una empresa realiza, y en esa cadena de suministro también pueden haber impactos negativos, graves violaciones a los derechos humanos que, digamos, la empresa que compra estos bienes también debería considerar para tener una debida diligencia en derechos humanos. La siguiente, por favor. Bueno, hemos visto muchísimo este tipo de titulares, ¿no? Donde damos cuenta, ¿no? O donde se observan estos malos comportamientos de parte de la industria, en donde, por ejemplo, la industria farmacéutica no permite dar licencias para los medicamentos genéricos. Por ejemplo, en México tuvimos las denuncias de organizaciones de la sociedad civil que mostraron cómo el lobby hizo un gran esfuerzo por evitar el etiquetado frontal en México, ¿no? Que tenemos un grave problema de obesidad y de diabetes. Entonces, bueno, hay como todos estos problemas que ya hemos mencionado, pues hacen parte, ¿no? De la discusión pública, y que pues reconocemos como pues bastante documentados. En nuestro posicionamiento pues también están las fuentes donde están, digamos, mostrados todos estos ejemplos, en donde pues se puede ver cómo funcionan estas malas prácticas corporativas. La siguiente, por favor. Ahora, estos rankings mal diseñados también tienen un impacto, no funcionan porque sí, ¿no? Por un lado, pues ya decíamos que utilizaban datos propios construidos por las propias empresas, entonces no había una instancia independiente. Esto por lo general permite hacer un washing, un lavado de imagen en español, ¿no? Para tratar, ¿no? De mejorar la reputación corporativa. También hay como una negación al cambio, es decir, son eh, elementos que les brindan, digamos, el respaldo a las empresas para mantenerse como están y evitar introducir estos componentes de derechos humanos. Y lo tercero, pues, es también la legitimación de este impacto indebido en las políticas públicas, ¿no? Esos son elementos también como que hay que tener bien claros de cómo funcionan estos rankings. En los primeros lugares vemos empresas con dudosas prácticas, tanto en alimentación como en la industria farmacéutica. La siguiente, por favor. Un poco esto es el uso que algunas de las empresas le dan a estos rankings, ¿no? Por ejemplo, Danone, que obtuvo el primer lugar del ADNI, utiliza esto para promover su imagen, para promover sus operaciones, para lanzar un mensaje a la sociedad de responsabilidad, ¿no? La industria farmacéutica también ha utilizado de manera digamos, instrumental estos resultados del ADMI. Y estos son solo algunos ejemplos de cómo se utilizan, ¿no? Por ejemplo, en el diálogo con inversionistas también se utilizan los resultados de estos índices que son privados y son elaborados con las condiciones que ya hemos mencionado. La siguiente, por favor. Bueno, yo quisiera concentrarme en cómo estos índices posibilitan eh, pues estas malas prácticas, ¿no? Por un lado, vemos que aunque en los índices aparezcan estas grandes empresas como las mejores en cada uno de sus ramos, pues sí hemos visto, ¿no? Cómo estas mismas empresas también hacen parte de estas malas prácticas como el abuso fiscal corporativo, ¿no? Por ejemplo, Pfizer. El Senado de Estados Unidos descubre un proceso de evasión fiscal a gran escala. También no olvidemos que son empresas con gran poder monopólico. Pfizer, Moderna, AstraZeneca, Johnson Johnson, Sanofi, GlaxoSmithKline participaron en agresivas estrategias de especulación y fijación de precios que fueron opacas e injustas durante la pandemia del COVID-19. En el caso de la industria farmacéutica, pues sabemos que son 20 las empresas farmacéuticas a nivel global que controlan el 60% de las ventas globales y pues ahí es donde vemos cómo se expresa este poder monopólico. La siguiente, por favor. Esto, por supuesto, aunque ellos digan en el índice que hay mayor acceso a poblaciones de bajo ingreso, en lo que observamos durante la pandemia, esta es una imagen de cómo se distribuyeron las dosis iniciales y de refuerzos de la vacuna COVID. Como vemos, pues la mayor parte de las dosis estuvo orientada a países de altos ingresos y medios, dejando por fuera a los países de ingresos bajos. Entonces, aunque el índice diga que hay mayor acceso a las medicinas, lo que vemos al observar los datos de acceso real es que no es tal, ¿no? Entonces, este es uno de los ejemplos. Además, mencionar que, como ustedes saben, durante el COVID, pues si bien hubo el desarrollo de una vacuna o de vacunas en plural en tiempo récord, hubo una especie de nacionalismo de vacunas, ¿no? Donde algunos países acapararon la mayor cantidad de medicinas, no hubo publicación de contratos ni de precios en Poder. Hicimos una investigación sobre este tema, donde mostramos la opacidad por parte de las empresas y de los estados, ¿no? Y donde se reveló que las empresas em, concentran, digamos, el poder de mercado y hacen que los estados acepten los términos de contratación. Ya vimos también la desigualdad que generan estas prácticas y por otro lado, pues también sabemos que las empresas se beneficiaron de la inversión pública para el desarrollo de estas patentes y que posteriormente se han negado a generar o a hacer genéricos, ¿no? Medicamentos genéricos que tengan mayor acceso a la población. La siguiente, por favor. Bueno, y además de lo que ya hemos mencionado, pues esto de la distorsión de la ciencia, la evidencia y la práctica profesional. La industria farmacéutica también tiene un historial de influencia indebida en la opinión y en las prácticas médicas, financiando investigaciones y haciendo una publicación selectiva de los casos. También ha habido un proceso de digamos, en que las empresas han necesitado esquemas de accionistas para financiar sus operaciones y esto en últimas hace que, digamos, la empresa tenga que rendirles cuentas a los accionistas, generar riqueza a través de esa vía, dejando por fuera, digamos, los costos sociales de sus operaciones, ¿no? Entonces, tiende a haber una externalización de los costos sociales, sanitarios y ambientales que recae en la sociedad, recae en los gobiernos y las empresas no se hacen cargo de esto, ¿no? Entonces, también tenemos que ver este fenómeno de la financiarización como un elemento fundamental para entender cómo funcionan estas empresas, los intereses que persiguen y cómo están estructuradas. también este lobby que es antiético, ¿no? Es por ejemplo, un lobby agresivo para evitar el etiquetado frontal de alimentos. En México hay una política pública, dada la situación de diabetes y obesidad, en donde lo que se ha establecido es que los alimentos tengan un etiquetado frontal para decir si tienen exceso de calorías, exceso de grasas, exceso de sodio, para que las personas puedan decidir de manera informada, y pues ha habido un lobby bastante agresivo para tratar de evitarlo. No se ha logrado, pero digamos que siempre ha estado como presente ese lobby, también de manera reciente con el tema de los alimentos procesados en las escuelas. Se ha dado la directiva de eliminarlos del espacio escolar, pero ha sido muy complejo justo por este lobby. La siguiente, por favor. Bueno, pues muchas gracias por la escucha y el tiempo y también la oportunidad de presentar este posicionamiento en español. Muchas gracias.
Pues yo creo que Diana, muchísimas gracias a ti por tu presentación excelente. I will now switch to English. Diana, thank you so much for this very insightful presentation, which I now have the honor to summarize in English. So, yeah, Diana in her presentation argues that the independent expert group argues that current approaches to corporate accountability in global health, and particularly voluntary market-based tools such as corporate scorecards and rankings, are inadequate and potentially harmful. Additionally, in her presentation, Diana highlights how transformations in the global political economy have strengthened the power of transnational corporations while weakening state regulatory capacity through liberalization and self-regulatory governance models. And these corporations contribute to worsening health outcomes and inequalities through harmful commercial practices, tax avoidance, labor exploitation, environmental damage, and political lobbying. Diana, afterwards you focused on the widely used indices such as the Access to Medicine Index, the ATMI, and the Access to Nutrition Index, the ATNI. And you, examined them critically. Although they claim to improve access to medicine and nutrition, the expert group finds that they suffer from serious methodological flaws, weak standards, poor data transparency, and additionally, an over-reliance on voluntary corporate self-reporting. They often ignore corporate misconduct, for example, price gouging, tax abuse, lobbying, scientific manipulation, and exclude smaller companies and supply chains, thereby reinforcing corporate market dominance. Your presentation, Diana, shows that poorly designed rankings can legitimize corporate influence over public health policy, enhance corporate reputations without meaningful behavioral change, washing, and divert attention from systemic and structural reforms needed for health equity. Diana also provided concrete examples, including corporate tax avoidance by pharmaceutical companies, monopolistic pricing during the COVID-19 pandemic, unequal global vaccine distribution, undue corporate influence on nutrition labeling policies, and aggressive lobbying against public health regulations. Yeah, Diana, in the end, you also showed us that the expert group concludes that voluntary rankings cannot substitute for robust binding regulatory frameworks. It calls for more rigorous, transparent, and inclusive monitoring mechanisms grounded in public interest, democratic oversight, and structural reforms to effectively regulate corporate power in global health governance. Thank you so much once more, Diana, for your great, excellent presentation. And yeah, we leave this now apart and come to our next presenter, our next speaker, Ashka, who will now focus on principles for effective corporate accountability. Ashka will speak in English. You hopefully will get the translation into Spanish according to the instructions in the chat. And after the presentation, I will give you a summary in Spanish. So Ashka, the floor is yours.
Thank you, Katerina. Can you actually give me just 1 second? Could you hear me?
Fantastically well, yes.
Oh, okay. For a second you were breaking up for me, so let me just share this again. Can we all see the slides I'm
very
sharing?
Well, Ashka,
okay,
well,
wonderful.
Yes.
Thank you, Katerina, again. And thank you to the team of IIGH. I mean, it's been a pleasure to be part of this experts group investigating these critical issues with some urgency. It was a wonderful community of folks. I hope that we can do great things in the future. So moving from what Diana shared, I will be sharing how we really need to focus on what corporate monitoring and accountability then means, if not voluntary and a half-baked, badly designed matrix. But before that, I would like to share my own conflict of interest declaration. In this, I declare that I have none. Corporate accountability, the organization I work with currently, represents many members, thousands of them. We do not take any contributions from governments or corporations. We're only member funded primarily. We take some financial support from carefully vetted foundations. So this is the overall outline of what I would cover in the next 15 or so minutes. Why it's absolutely urgent to figure out what corporate monitoring and accountability actually mean in the evolving sort of landscape of shifting and consolidation of corporate power. What are some of the principles that the experts group are proposing that we embrace for moving to this kind of effective accountability mechanisms? Some examples of model solutions in practice, and then how fundamentally this remains a question of power. So Diana actually shared some of these highlights. You know, we are living in quite a unique times, and the way public health itself, you know, the idea of public health has evolved since early 19th century. And the way corporate consolidation and the idea of transnational corporation has kind of grown in the past 30 to 40 years under the blessings of neoliberal capitalism is something that needs urgent attention. We are seeing that you know, there are more and more transnational corporations that have extraterritorial impact and a lack of accountability mechanisms. Most of them are headquartered in global north with resources and labor inputs from the global south. We are seeing a very complex web of subsidiaries and investors, right? By 2022, the leading transnationals created nearly 370,000 subsidiaries globally. So it's a very opaque sort of ecosystem to track, to monitor, to assess, to expose. We are also seeing this emergence of philanthropocapitalism, so this co-optation of the third sector, as we say. There's immense diversification of product portfolios. We are seeing very harmful industry actors like Philip Morris International getting into pharmaceutical business of developing COVID-19 vaccines and such. We're also just seeing sheer explosion of number of transnational corporations. Well, in 1970s, there were approximately 7,000. We now have more than 40,000, and 90%, nearly 90% of them are sort of based in industrialized nations. We're also seeing decrease in publicly held corporations. This is actually very interesting and important. So the number of public companies listing in the US actually peaked in the 1990s and has fallen by nearly 50%. So the ownership of these corporations are being now also concentrated in the hands of very few institutional investors rather than people like us, you know. So, and on the flip side of it, the ground reality for civil society and social movements are also becoming pretty dire with, organizations working at this bleeding edge of human rights and advancing corporate accountability at much higher risk of what we call strategic litigation against public participation. There is certainly rise of totalitarianism, political division, and so on. So this is sort of the landscape within which this experts group has convened to figure out how do we really make the invisible visible in terms of corporate behavior and malpractice. So Diana, I think, discussed these 5 sort of harmful corporate behavior through some examples of, but these are the modalities, the 4 modalities that we are seeing through which the corporations and private actors in healthcare, in food and nutrition, and many other sort of intersectorial issues are advancing these harmful corporate behavior, right? They're heavily electioneering, funding ballot initiatives, getting leaders in the highest offices in countries. We are, of course, seeing lobbying science. Diana shared a lot about that. And then we are seeing this co-optation of charity. So large health funders are actually setting the mandate for what global health even means and should prioritize. So this is just one example of the food industry, ultra-processed food industry. We are seeing profit and control concentrated in the global north and extraction and impact concentrated in the global south. And just to give you an example, most of these large actors from the food industry who are addressed in the Access to Nutrition Index are proud to be operating in 50 to 200 countries. And based on the recent financial reports, with annual revenues of 30 to 50 billion US dollars, companies like Coca-Cola, PepsiCo, Nestle have, that are showcased in these indices have revenues larger than the GDP of 100 to 150 countries, making them these economic superpowers comparable to, and in most cases, even greater than many nations. And so in this sort of reality, I think the Mexico example Diana shared already, but we are seeing this, and this is just one example of food and nutrition. We're seeing extreme capture of public policy, nutrition, food, agriculture policies across the world. I mean, right in my home country in India, we have seen the food lobby, the ag lobby work day and night to not let strong public measures pass, like sale of ultra-processed foods near schools, and so on and so forth. And there are so many examples out there in the academia, in civil society, and also in the press. And so this is sort of the expanse and depth of the corporate influence and capture of public health, nutrition, and well-being. And this is the reason why we need to frame this type of corporate behavior as actual liability for corporations. So when industries release tons of pollutants in the water or air or soil, when they make billions selling products that burden healthcare systems, to when they penetrate our political and sort of democratic spaces to aggressively protect their profits at any cost, all of these increase corporate liability. And ultimately to increase the liability of corporations for their actions, this monitoring and assessment methodologies and mechanisms have to be robust and certainly not voluntary, and also quite inclusive. And I'll get to that in a second. But we are seeing that more and more sort of business institutions and investors are also recognizing the poor and weak governance practices of corporate political activities. And drawing on the experts group's analysis, we have identified 5 interrelated design features, that make these type of voluntary badly designed rankings and scorecards quite actually harmful at worst, and at best quite ineffective. So, and again, I won't go into all these 5, but Diana mentioned these, from weak standards to neglecting smaller companies and the robust supply chains of these private actors. And so what does moving closer toward real sort of accountability even mean? And so the critique of corporate-led, voluntary, badly designed, half-baked scorecards does not preclude the need to actually have ways to assess and monitor corporate activities, especially if we want to expose it, challenge it, and compel these entities to eventually change their behavior. So, it is important that we constitute effective monitoring mechanisms that are certainly not determined and designed and owned or co-owned by either corporations or private actors themselves, or entities that are influenced or are conflicted in their relationship with the actors that they are claiming to assess or score. And so to address some of the pitfalls of these existing scorecards and indices, the experts group have proposed these 3 principles, which could at least get us started on envisioning a mechanism and architecture of assessment and corporate accountability. First being that such monitoring assessment must use standards that serve the public interest and cover a spectrum of harmful and antisocial forms of corporate behavior. We cannot have selective measures to give ranking on sort of universal behavior. So even the measures have to be quite inclusive and universal. The second is such assessment must use plurality of data and evidence. And then the third being that it must actually cultivate a wider system of good governance. And just to go quickly through each one, the first one, which discusses this addressing of spectrum of harmful and antisocial sort of actions of corporate actors, this principle basically, the way I see it, it deals with the what, right? The standards against which the TNCs are monitored and assessed need to be strong. And these are some of the ways, and we have provided a 3 sort of pronged framework for this, of product services, but also corporate governance practices. How are corporations determining their internal, sort of say, treatment of staff, tax-related conduct, financial management, and so on. And then the third set of what's are concerns and behaviors related to the external actors. So this is where their political activities, how they're influencing science, working with academics, and so on, could be measured and evaluated. The second principle, which is we are looking at the data that are being used by these scorecards, and we believe that they're really exclusionary, they're not inclusive. So we are proposing through the second principle, the how, right? So how do we look at corporate monitoring assessment should not be limited to a set of just quantifiable indicators on limited standardized data sets, but should be democratic, eclectic, pluralistic, and should actually be a mixed method type, a qualitative and quantitative sort of collection of kind of information and knowledge. And in that, working and listening to, I think there's a great sense of listening to what investigative journalists are saying, what academics, independent academics are researching, the whistleblower complaints, the legal proceedings, and so on and so forth, which can create, this Rumi's elephant, where we are not just touching one part of the elephant, but at least trying our best to create a full picture through these inclusive kind of research and assessment measures. And this brings us to the third principle, which is at the end of the day, this has to create a system of good governance, right? It must compel these private actors in health and nutrition and food and other sectors to to adopt ethical and socially responsible activities. And so in this, in the public monitoring of corporate behavior is important. Powerful commercial actors must also be governed by rules and obligations that prohibit and sanction unacceptable behavior. And in this, a well-functioning state is an absolute critical a power that we must reclaim in certainly in today's political hegemonies across the world, to ensure that the good governance can even be collectively imagined by us and then implemented. And this is where it gets really tricky, and I come to that later in the presentation, that governments actually should be enabled to hold these actors accountable, while currently they're certainly dependent on these corporate actors to even get into power. So we certainly are, this is not blue sky thinking, right? We want to make sure that these actually become reality one day. So on that, we have had champions within the UN system, UNSR, the Special Rapporteur on Right to Food, the former Special Rapporteur on Right to Health. All of these experts have recognized the critical precipice we are at of really holding corporations to account. And in this, market-based voluntary approaches to improving conduct and behavior of TNCs has fallen flat. In fact, it has done much more harm than good. And these scorecards and these incremental changes certainly are not a path forward. What we need is these accountability mechanisms to be inclusive and radical, and not incremental, and in kind of a sort of a falling into more of a corporate social responsibility type activities. So does anything like this already exist? Do we know where the starting point could be? The answer is actually yes. There are several model solutions implemented that offer a great starting point to monitor, assess, and even repair some of these complex ecosystem of bad behavior of corporations. And some of these are not perfect, and they have many fault lines, but they certainly are good starting points to start co-creating some of these mechanisms and sort of strong, inclusive ways to first assess corporate behavior, then expose it, and then challenge it. And we have been, as corporate accountability, part of these two specific sort of efforts. One is the accountability framework for the UN, the framework on climate change, and the other one is this comprehensive legal framework for corporate accountability in food governance. Both of these frameworks have very critical pieces that any sort of corporate monitoring and assessment mechanism should have, such as disclosure of conflicts, prevention of conflicts, corporate liability, access to justice, good governance, and so on. So I'll be happy to share more details on this after the presentation. And in the recommendations section of the expert statement, we also put a call out to 3 specific groups of entities: the WHO and the global agencies with a health mandate, including global health funders. We call them to avoid supporting or legitimizing corporate monitoring and accountability initiatives that lack evidence of impact and that may actually inadvertently reinforce corporate power. The second group is we call on organizations involved in corporate monitoring, like ourselves, to adopt stronger and more holistic approaches as described earlier. And third, we call on governments and other public agencies to work together to institute, the UN guiding principle on business human rights and support creation of forthcoming legally binding international human rights instrument regarding the activities of transnational corporations and other business enterprises. And there are specific policy guidances within all these 3 groups already that can guide us, that can be this beacon of hope in the trying times that we exist in currently, through the UN system itself, from civil society, and some national jurisprudence. And I won't go very deep into this because, again, many of you might be very familiar with this, but Article 5.3 was introduced in the Framework Convention on Tobacco Control after rigorous organizing by hundreds of activists and policymakers, primarily from the Global South, and has become a gold standard for firewalling policy from industry influence. So this is one sort of very strong precedent that we have. The second one is also from the FCTC maximizing transparency decision. So during the FCTC's COP9, in a statement on behalf of the regions, Brazil announced that 23 out of the 28 parties of America region participating in COP9 voluntarily signed and submitted these declarations. They're still voluntary declarations, and our work is to make them mandatory. But this decision that was taken at the COP really kind of provides a modus operandi for Article 5.3 to be a real world sort of success and an effective measure to prevent, in this particular case, tobacco industry's influence on tobacco control measure and policy development. The third one, again, as an example, it's the WHO FENSA, which is the WHO framework of engagement with non-state actors. Now, I have to say that these have loopholes, and we believe that they can be much more stronger, but they do have ways that can be helpful and kind of guiding to develop much stronger corporate accountability mechanisms to hold private actors in public health accountable. And so also the WHO financial regulations and financial rules is another such example. And then we have the UNFCCC, the framework that I had mentioned before that we had been fortunate to participate in, also actually resulted in some success in the UNFCCC space. So after more than 3 decades of climate talks where big polluters have penned the rules of climate action, a couple of years ago, Kick Big Polluters Out, it's a civil society coalition that secured the first steps toward formally weeding out big polluters' influence when all participants were required to disclose their affiliations. And then this last September, as COP30 confirmation opened, when delegates could formalize their participation in the COP30 climate talks in Belém, Brazil, in addition to all participants continuing to publicly disclose their affiliations, the non-government participants from COP30 onward were also expected to, 1, publicly disclose who is directly funding their participation, and 2, publicly confirm in writing that their individual objectives are in full alignment with the UNFCCC Paris Agreement and Kyoto Protocol. So there are some mechanisms that are and efforts that are really kind of radical. They seem radical, but one can say they're common sense to again advance these effective accountability and corporate monitoring activities. And last but not the least, national levels, we are seeing countries like Brazil, Colombia, Mexico, among many others that have strong codes of conduct and policies for conflict of interest. In Brazil, actually, the agendas of senior government officials, such as that of the president of the Republican ministers, are publicly disclosed. And in the EU, for example, 7 member states have national legislations that stipulate that former members of parliament must refrain from taking up employment or engaging in a paid relationship for a certain period after the end of their public mandate. So ultimately, we need to see the lack of industry accountability and explosion of these voluntary, badly designed efforts that legitimize the status quo around corporate behavior as a dysfunctional and unjust architecture of power, where power has been hoarded by a very few elite corporations and their executives that now have the power to determine what politics and policies even mean. And so we need to reclaim this power and share it among workers, consumers, communities, people who make corporations government possible, right? So, and in this endeavor, civil society actors, social movements, journalists, independent experts, scientists, and cooperative movements have a critical role. The second is international rule-based system, which again seems to be crumbling right in front of our eyes these days, has held immense value. And since the 1970s, when we had the UN Center on Transnational Corporations, which was certainly shut down in 1992, to today, when we have kind of massive social movement behind the Business and Human Rights Treaty, trying to really bring corporations to account and address their extraterritorial impact and abuses. This is critical to have international commitments and sort of global solidarity. And finally, in a highly fractured neocolonial sort of geopolitical reality, but where, world is deeply connected, information flows rapidly, we must safeguard and strengthen our democratic institutions that are for, by, and of the people. And at Corporate Accountability, we have worked on what we call 2 grand strategies that you can see here to address, these levels of change. One is to organize masses of people to demand change, and second, to lock in that change through securing strong policies. So whenever we talk about corporate accountability and corporate monitoring and assessment, I think it's important to keep these dimensions of transformational change and in the core of the design of such a mechanism. And this is my last slide. So it is about time we embrace the messages that these protesters are screaming here. This is an interesting image because in courthouses across the US on January 20th, 2012, so exactly 14 years ago from yesterday, thousands of protested a landmark US Supreme Court decision that removed most limits on corporate and labor spending in federal elections, infamously known as the Citizens United versus the Federal Election Commission. A crowd gathered on the sidewalk outside the US Supreme Court and its 1,300-pound bronze doors, which were shut down because of the protests, and they chanted, "Whose steps? Our steps," and had these placards. So yes, we as governments, private sector, and global institutions will one day soon need to stop treating corporations as people and money as speech. We are the people, and it is our speech that will matter at the end. Thank you so much.
Thank you so much, Ashka, for your amazing, wonderful presentation. I will just wait a second until the screen is switched again. So thank you very much. I will now try, it's not easy, to summarize your excellent speech into some Spanish, in a Spanish summary. So I will now switch into Spanish. Un resumen. Por cierto, yo vivo en Madrid, en España, por lo cual hablo en castellano. Disculpas a nuestras amigas y amigos en Sudamérica, ¿vale? Pero entiendo que nos entendemos. Empiezo. La rendición de cuentas corporativa en la gobernanza de la salud global necesita replantearse más allá de los rankings y las medidas corporativas voluntarias. En su presentación, Ashka sostiene que los enfoques actuales de rendición de cuentas corporativa en la salud global, especialmente los basados en rankings, scorecards y medidas voluntarias, son insuficientes y adicionalmente, y en algunos casos, contraproducentes para proteger el interés público y la equidad en salud. En las últimas 2 décadas, el poder corporativo transnacional ha crecido de forma acelerada, caracterizándose por estructuras empresariales complejas, extraterritorialidad de las operaciones, concentración del control y los beneficios en el norte global, y externalización de impactos sociales, sanitarios y ambientales hacia el sur global. Este contexto ha dificultado la capacidad regulatoria de los estados y ha aumentado la influencia corporativa en los procesos de toma de decisiones públicas. Ashka siguió en su presentación e identifica prácticas corporativas nocivas recurrentes como la evasión fiscal, el abuso de poder monopólico, la distorsión de la ciencia y la evidencia, la financiarización orientada al beneficio a corto plazo y el lobbying antiético, que suelen quedar fuera de los rankings corporativos tradicionales. Y nos ha dado algunos ejemplos del sector de alimentos ultraprocesados que muestran cómo las empresas han interferido activamente en políticas de etiquetado, fiscalidad y protección de la salud infantil en países como en México, en Brasil, en la India, en Sudáfrica y también en Estados Unidos. Luego Ashka, apoyándose en el análisis de United Nations University International Institute for Global Health, describe 5 deficiencias estructurales de los rankings corporativos. Primero, estándares débiles, omisión del mal comportamiento empresarial, dependencia excesiva de métricas cuantitativas estandarizadas, mala calidad y opacidad de los datos y exclusión de empresas más pequeñas y de las cadenas de suministro. Estos fallos contribuyen a evaluaciones sesgadas, al lavado reputacional de las empresas y a la legitimación de su influencia sobre las políticas públicas. Y frente a ello, Ashka se propone avanzar hacia un enfoque integral de rendición de cuentas basado en los siguientes 3 principios. Primero, que el monitoreo corporativo sirva al interés público y cubra todo el espectro de conductas empresariales dañinas. Segundo, que se apoye en una pluralidad de datos y evidencias, incluyendo periodismo de investigación, investigación académica, comunidades afectadas y procesos judiciales. Y tercero, que esté integrado en un sistema más amplio de buena gobernanza, con normas vinculantes, sanciones efectivas y estados capacitados para controlar el poder corporativo. En su presentación, Ashka concluye que la prevención es preferible a la corrección ex post. Los enfoques voluntarios y de mercado pueden reforzar el poder corporativo en lugar de limitarlo. Se destacan experiencias y marcos existentes, como ella ha mencionado el artículo 5.3 del Convenio Marco de la OMS para el control del tabaco, las normas FENSA de la OMS y los mecanismos de divulgación de conflictos de interés en la CMNUCC como ejemplos de políticas más sólidas para proteger la salud pública. Y en última instancia, ella, Ashka, subraya el papel central de la sociedad civil, la transparencia, el Estado de Derecho y la voluntad política para lograr una gobernanza de salud verdaderamente orientada al interés público. Yeah, so I really made this effort to capture it all. I hope I did it. Yeah, I made it. And we are already coming a transition now to the Q&A session. And before we come to the Q&A session, where we would love to listen from you, dear audience, and engage with you in your questions and also your comments, just to summarize here 5 headline takeaways. As a summary of both presentations, and as both mentioned this year that we have been all together discussing a lot, engaging. It was really interesting. Also now from my side, a big thank to the whole expert group. So the 5 takeaways. Voluntary rankings are not accountability. So corporate scorecards and rankings rely on weak standards and self-reported data and cannot deliver real accountability or protect public health. Second, rankings can actually do harm, not just fall short. So poorly designed indices may legitimize corporate power, enable reputational washing, and undermine meaningful public interest regulation. 3. Corporate harm goes far beyond products. So true accountability must actually address tax abuse, monopoly power, lobbying, scientific manipulation, and political interference, and not just access initiatives. 4. Monitoring without governance is ineffective. So transparency and measurement alone are insufficient. We need binding rules, sanctions, and strong public institutions are essential. 5, and last, accountability is ultimately about power and democracy. And protecting global health requires shifting power back to people and public institutions through rights-based, rule-based governance and not market-led solutions. Yeah, so this it is from us. And now, if I'm not mistaken, we open the floor to either get read your questions in the chat or invite you to open your micros and your cameras and interact with us. So the floor is yours. And maybe, because we thought maybe at the beginning people might be shy, I had prepared a question. So maybe Ashka, you could start with this question because you speak a little bit on civil society, but maybe you could further develop on, and then maybe after Ashka, Diana, the question would be, what role can civil society play in holding transnational corporations accountable? What would your suggestions be?
Thank Katrina. So I think this is a question that I imagine the entire civil society is questioning itself on. I think we do need to further define what we mean by civil society, because in the time when, as I mentioned in my presentation, philanthropocapitalism exploding, and a lot of civil society actors actually are being more aligned with corporate interests for sheer survival of their own mission. We really must redefine what civil society means to be able to answer that question that you raise. We live in an age of professionalization of social movements. We are seeing, and as soon as there is a professional organization, it cares more of its own survival than sometimes its own mission. And so to kind of rephrase what you asked, I would say, how do social movements actually hold corporations accountable? And I think the only hope we actually have currently in the sort of geopolitical sort of dynamics that we are seeing play out within countries, communities, but also across nation states, I think this is the age of social movements. And I think we are maybe past the age of professionalized NGOs. We certainly have, there's a lot of literature on what the third sector means, and it's been seen as an extension of the state. But when the state itself is this corrupt and is turned into either oligarchies and best case scenarios and worst dictatorships, where does this extension even play out? So I think the response would be objectivity of civil society if it's in an organizational format. Otherwise, really learning from social movements, listening to social movements, and being led by social movements is how I think we can hold corporations to account.
Thank you. Diana, I don't know if you would like to also tackle this question.
Sí, justo lo que planteaba Ashka, es que esa es la cuestión, ¿no? El centro de la cuestión para las organizaciones de la sociedad civil, qué hacer con este poder corporativo que cada vez es más grande, con estados cada vez más débiles y ahora en una deriva autoritaria en muchos de nuestros países. Sin embargo, pues no debemos quitar el dedo del renglón e intentar desde donde estamos empujar esta agenda, donde las empresas sean responsables, pero con un enfoque de derechos humanos, no desde la responsabilidad social empresarial que se vende como algo muy proactivo, como algo, como una dádiva, cuando en realidad como empresas y como todos los agentes en una sociedad, pues pueden haber violaciones de los derechos humanos en el sentido de que todos debemos cumplir con ello al menos, ¿no? Al menos no generar daño a terceros. Por ejemplo, en México se ha estado discutiendo la posibilidad de una ley de debida diligencia, pero ha sido muy complejo porque justo como las empresas han tenido digamos, poca presión por parte de los estados para hacer esto, no tienen los incentivos para aceptar una ley de debida diligencia y políticamente también ha sido complejo, incluso teniendo como el ejemplo de la Unión Europea, que tiene la directiva europea para las cadenas de suministro, que pues estamos viendo que la discusión europea lo que se quiere es echarla para atrás, cuando ha sido un mecanismo, por ejemplo, para nosotras desde poder para pedir rendición de cuentas en las cadenas de suministro de la industria del cobre, que es una de las industrias que trabajamos y que han tenido un impacto gravísimo en los territorios y más ahora con la transición energética, que como ustedes saben, ahora que se habla de energías limpias, de la transición a energías renovables, pues se necesita de todas maneras minerales y esos minerales están en el sur global. Entonces sí necesitamos reforzar esos esquemas, ver la manera también de entablar pues un diálogo también que no esté atravesado por el lobby, ¿no? Porque también en muchos de los espacios donde se intenta promover esto, pues ahí aparecen los lobbies que tienen mucho más poder también y mucho más dinero para pues llevar a cabo agendas que les benefician, ¿no? Entonces nos vemos en muchas dificultades para llevar a cabo este tipo de agendas, pero seguimos presentes y seguimos exigiéndolo.
Thank you so much to both of you. So in fact, Ashka, I did not reformulate your answer into Spanish. Maybe I will just summarize Diana's contribution. And I like so Diana once more said it cannot be a corporate social responsibility, but rather legal binding rules. So for example, she mentioned the due diligence directive that we have here in the European Union, and but unfortunately also it was watered down. So now the scope of this directive is for for companies with more than 5,000 employees, and we know that this is really very little companies, and which then had the effect that also other countries outside of the European Union lost interest in very similar legislation like the due diligence directive in the European Union. Okay, I think we have one question in the chat from Patty Rundal from the Baby Milk Action I understand from the UK. Thank you so much, Patty. And so this question is about protecting monitoring from commercial influence,
Yes,
which is one of the most tricky things. Yeah, Patty, would you like to elaborate on this?
Yes, I would, and thank you so much. It's been really wonderful to hear the presentations. But we've been following. I'm from IPVAN, and we've been following this whole business of ATNI and other, sort of voluntary agreements and voluntary monitoring for so many years. We were there right at the beginning when ATNI took off. And the thing I wanted to say is, we knew that it was all about investment and that it was actually working with the companies to whitewash them. But it was very, very alluring because nobody else was doing monitoring of all the companies, all the big ultra-processed food companies. They weren't called ultra-processed in those days. They were just junk foods. And so they were the only ones doing that. And what I'm asking is, all the UN, UNICEF, everybody got involved into the scaling up nutrition and all these other multi-stakeholder approaches, and used the ATNI and other rankings, the voluntary rankings, to do a lot of harm, I think. And I still think it's still there and it's still a lot of harm, but it's very difficult to, and I think they're seeing it now, that actually a resolution that we got in 96 talked about protecting monitoring from commercial interest. And as far as I'm aware, that is the only resolution, unless the tobacco one specifically says that. We have to hold on to the fact that if you have commercial interests, which ATNI does have a commercial influence from the company, then it's not sound monitoring. You see? So I just wonder whether, from Ashka's point of view, and does the tobacco lobby, does the tobacco framework specifically say that? Because I think it's necessary, and monitoring is going to be more and more, but it's tiring, and it's you're going to keep doing it all the time, and nobody has any energy to keep doing it, and they might do it anyway. It's a bit of a long-winded question, but I think it's the alluring nature of these voluntary things that takes people in, takes all the civil society in, and then before you look around, everyone's taking the corporate money, and there's very few left. So I totally agree with you, Aska, that the time is right for civil society, but in a different way, you know, that it's really got to be looked at. Thank you. But if you have any questions, that would be any answers, that would be great.
I would love to hear what Diana also has to share, but I think, Patty, you answered your own question to some extent. So
typical.
Yeah, the other thing is that austerity and accountability cannot go hand in hand, right? So we're seeing these massive austerity, deregulatory efforts by countries. It's certainly making our job more difficult to monitor, because then the public accountability is also decreasing. And one of the things I'd mentioned in my presentation, which is that we are also seeing reduction in public corporations, right? So they're more and more now held in private hands and private closed door, opaque institutional sort of a group of investors, and or families even, individuals. So I mean, it's true that I have no rosy picture to show you or anyone else. I mean, it is hard. Also, what you mentioned about ATNI, and there are many, indices and scorecards that keep coming up. I think this is where some very basic common sense practices of always demanding declaration of conflict for interest, always looking into, power mapping, the leadership of such entities and exposing that. I think, sort of really bringing things to the fore, right? So literally our corporate accountability's actually logo is this, making invisible visible. And then I think we also have to understand that we live in an age where the press is becoming increasingly compromised, right? So partnering with the journalists who are working in public interest, who are independent, is critical, because all of this monitoring and assessment, we can have so much of it. I'm sure all of our computer folders are filled with abysmal track records of corporations, but how is it actually transforming into real change, real campaigning, real demands, and then at the end of the day, legal jurisprudence? I think it's a journey, and I'm glad to be on it with folks like you, but I would love to hear what Diana has to share too.
Yeah.
Solo decir que comparto la apreciación de Patty y también de Ashka, de lo que se ha dicho. Creo que nada más añadir que es verdad que es muy difícil y costoso estar haciendo visible lo invisible. Justo hacer esta búsqueda de información de manera independiente, construir los datos, eso nos lleva muchísimo tiempo, pero es una de las estrategias que tenemos para visibilizar cómo estas malas prácticas empresariales, cómo están impactando de manera negativa en la población y es necesario seguir haciéndolo. Eso, nada más, Pati. Y en el chat justo te contestaba David sobre la independencia del ADNI.
The chat. Yeah.
Exactly, Patty.
Katrina,
So,
if I may
yeah.
add just one last
Yeah.
thing, because I mean, this is a very important question. And my last slide, which had that picture of Citizens United versus the FEC, it is important because I think if we don't have the state, an independent welfare state, right, none of this can be possible. So to bring corporate money out of politics, I think still remains for people who are working on this issue for decades, an absolutely fundamental conditionality to do any of this. So just wanted to underscore that.
I agree. keep it all out and free, but it's very difficult. We've just had a thing all on, food safety and everything. The whole structure of everything is very difficult, but we have to hold on to that. I don't think we can give way. It's so true. And people confused and thinking that the corporates are actually human and that they have human rights. That's the important thing, to get a distinction between them. They do not have human rights, but you can listen to them and hear them and everything, but really they're not. They are totally different from a human being. So thanks very much for letting me ask that. I'm just so pleased that you managed to produce that thing on ATNI, because I felt it was so many years we've been battling with it, and to have, 15 years really. So it's excellent to have the analysis. Thank you.
We thank you, dear Patty, for for your interaction with us. Thank you so much.
Great.
Thank you. And there is a second question by Lina Mai. Sorry for the wrong pronunciation. And I will just read it to you, yeah? So can't the index rankings based on products not be used to advocate for regulation, as frankly they show that the product portfolio of the TNC is still very unhealthy? Then other NGOs can focus on the other indicators of behavior of TNC and bring it together. Who of you, Diana or Ashka, who would like to go for it first?
¿Puedo empezar
Yeah.
diciendo que efectivamente eso es lo que intentamos hacer? Como decíamos en la presentación, los rankings generalmente están basados en información estandarizada, basados en cómo se entrega el producto o las cualidades del producto, pero no de todos estos comportamientos, ¿no? Empresariales. Entonces, bueno, un poco lo documentamos, pero claro, la capacidad de tener una presencia en los medios y a nivel público, pues es mucho menor, ¿no? De estos resultados de investigación. Las empresas tienen mucha más presencia, tienen propaganda, utilizan incluso estos índices para decir, ¿no? Que ellos cumplen de manera voluntaria con estos criterios. Entonces, esa es la cuestión justo. Y lo que a nosotras nos gustaría desde sociedad civil es justo que hayan criterios de debida diligencia en derechos humanos, en donde se tengan en cuenta los impactos negativos en las personas, no cómo el producto es entregado, ¿no? Esa es una diferencia sustancial. Otra diferencia sustancial es las empresas tienen como objetivo vender, generar ganancias para ellas y para sus accionistas, ¿no? Veíamos que un poco la financiarización lo que hace es reforzar esa dinámica, pero digamos que ese es como su objetivo, sin tener en cuenta la externalización a nivel ambiental y a nivel de impactos negativos. Entonces, eso te diría. Y bueno, no sé si Ashka quieras añadir algo más.
No, I think as much as I caught, Diana, I think I 100% align with what you're saying. I would also like to add to a sort of a distinction, right? When we say not, Lena, what you're saying is index ranking based on products not be used to advocate for regulations. I think this is where the real conflict lies. Who is advocating for regulations, right? Who at the end of the day is in the room to advocate for regulations? And this is where what Patty also mentioned, and we are living in the age of multi-stakeholderism that has suavely replaced multilateralism, that has been weakened by neoliberalism. So it's not, I don't think not using these indices or rankings for particular public activity can still be sort of a path toward a comprehensive accountability. I'm not sure you're suggesting that either, but I think the question still remains as to who gets to sit at the table. Why does ATNI and the foundations behind them have accrued so much power that they are in these spaces, the scaling of nutrition, the UN, and the governments? I think, again, at the end of the day, it is a question of power, and right now the power is hoarded by those who have access to resources, wealth. And I think so one needs, and this is where, again, we keep saying that the very basic demands for no conflict of interest, of no revolving doors, of having public accountability of these kind of efforts remain, honestly, the very first step to ensure that these rankings or matrix or frameworks, whatever lexicon we want to use, are at the end of the day changing the grassroots reality, which is that corporations are not able to take communities for a ride and harm our environment and weaken and sort of deteriorate our democratic institutions.
Thank you. Thank you so much. So I thank you for the question. Thank you so much, Diana and Ashka, for your answers to this question. We will now start closing the session. We will answer all the remaining and not answered questions in the chat via email. So don't worry, you will get a reply by us. And I would now like to close this session. First of all, thank you so much, said by Ashka and Diana, to the staff who accompanied us in such a professional way today. Yeah, without you, this would not have been possible. So United Nations University International Institute for Global Health staff and David and the whole team, thank you very much for making this possible. Dear Ashka, dear Diana, it has been an honor, and a privilege to be with you in this for 1 year. As Ashka said before, I would also love this just to be the beginning, of a longer conversation, because I think we're just at the beginning. And I think Patty's question and the exchange made this clear. We have long been waiting for this, and now one report is out there, but now I think we are all together in this, for, I want to call it good lobbying for the good cause. And and that leads me already to the next point, that you can download the report on the website. Maybe somebody can share this here in the chat, the website. You can get the report there. From there, we would be very happy to further engage with you, because once more, the conversation has just started, and let's continue it from here. And once more, Ashka, Diana, thank you so much for your great presentations. To the audience, thank you for listening and interacting with us. And see you very, very soon. Stay healthy, and optimistic. We need you. Thank you. Bye. Bye-bye.